Yeah, hi Glory.
Hello, Frida.
Yeah, let's begin.
Hi. Okay. Good evening, everyone. Welcome to today's health access session. The topic for today is post-abortion care, and our topic master is Jane Morethi. So before we begin, I will take you through the today's order. We will start by topic presentation by our topic master Jane Morethi. Thereafter, we'll have additional remarks from our CEO, Dr. Macharia Warwingi. Then we will have an interactive session. And thereafter, we will have summit announcement, and then I will conclude the meeting. So right now, we will have an opportunity to hear from our topic master. Jane Murithi, kindly confirm whether you can hear me.
Hi, Glory.
Hello, Jane. Okay, welcome. Go ahead.
Thank you. Good evening, everyone. Jane Murezi, nursing officer, and will be taking care.
Hello, it was audio.
Hello, Jane. We can't hear you. Hello, Jane. You are muted. Kindly unmute.
Okay, hi, Glory. Sorry I was late. So we have Jane Morethi, but she's... So Glory, can you hear me? Hello, Glory, can you hear me?
Hi.
Hello. Hi, Daktari.
Okay.
Okay, I was calling Jane, but she's back. Jane, you can go ahead. Hi, Jane. We can't hear you.
But she's having audio problems.
I'm sorry, the topic master is having, I think, network problems. Jen, can you hear me? Are you back? A
She's
minute,
having.
if I can with her. Let me call her, please.
Okay.
Good evening, everyone.
Good evening.
Can you confirm if you can hear me now?
Yes, we can hear you, Jen.
Okay, thank you. So, as had said earlier, I'm Jane Mureithi, and I will be taking you through post-abortion care. It's not such a quite long topic, but it is short, but I will take the shortest time possible also. So I will start by defining what is abortion. So abortion, we term abortion, we have a basic definition for abortion, and also we have the definition of the WHO, World Health Organization. For the basic definition of abortion is termination of pregnancy before 28 weeks of gestation. That is just a basic definition. Termination of pregnancy before 28 weeks of gestation may be with human interference or without human interference. According to WHO, the definition of abortion is termination of pregnancy before 28 weeks of gestation, or if the fetus weighs less than 500 grams. Termination.
Oh, she has disappeared again.
We can divide abortion into two larger groups. One, spontaneous abortion. Spontaneous abortion is without human interference. I mean that nothing has happened. The abortion has just happened. Then induced is where we have human interference. So there are causes that may lead to abortion. Before I go to a case study, there are causes that may lead to abortion. One might be genetic abnormalities may lead to abortion, e.g. abnormal chromosomal number may lead to abortion. Two, we have uterine defects. If the uterus of the mother is unable to handle the pregnancy. For instance, if we have congenital and acquired uterine defects like cervical incompetence. In cervical incompetence is where you find that the cervix of the mother will open up quite earlier, that it does not close. When a woman gets pregnant, the cervix closes naturally. So if the mother has cervical incompetence, it will not close to hold up the fetus in the uterus. Also, we have immunological disorders. We have also systemic diseases. Systemic diseases might be maternal, endocrine diseases, cardiovascular, renal diseases may lead to abortion. Also, trauma may lead to abortion. For instance, there are mothers who will have an abortion following that they had had a fall, so abortion might occur. Also, there are other factors like toxic factors like intake of alcohol in pregnant women may also lead to heavy bleeding. She's 18 years of age, being the first pregnancy, and she complains of abdominal pain and heavy bleeding. When you get to look for the obstetric history, she had undergone for she had underwent an abortion at the nearby clinic. She has no medical history. She has no issue. On examination, the abdomen, there
Yeah. Audio. See, audio is coming in and out.
yes, please, pardon.
Okay, you are telling us the history in examination, then you disappeared.
Okay.
Uh-huh. Could you start there on examination? Oh, she's gone.
Vitals, temperature of 39, blood pressure of 96/45, respiratory rate of 22. She is experiencing worsening pain and then collapses. The mom is immediately started on antibiotics. She's taken to the operating room and undergoes an MVA without complication. Now, our question is, what diagnosis do we give the mother, and what do we do next? So that is my case study, and as it goes by, as we go by, we will be able to tell what is our diagnosis in that matter and what are we supposed to do now that we have her in our facility. So I had said that I had classified the abortions into two broad categories, where we have spontaneous and induced. So there are other types of abortion. they all fall in the two main Can you hear me?
Yes, but you keep talking. Sometimes you are dropping off, but then you're coming back.
Okay. So I have said that there is threatened abortion, vaginal bleeding of less than 20 weeks without cervical dilatation. Cervical dilatation is the opening of the cervix. Then there is inevitable abortion, which means that it cannot be prevented. We have the inevitable abortion, dilated cervix, but no expelled products of conception. So meaning that the fetus parts still have not come out through the vagina. Then we have complete abortion, that is complete expulsion of all products of conception. Then we have incomplete abortion, where some products of conception are retained in the uterus. Then we have missed abortion. In missed abortion, the fetus has died in the uterus but has not passed through the cervical canal. Then we have septic abortion. Septic abortion is associated with infected products of conception and endometrial lining. So in spontaneous abortion, this abortion occurs mostly in the first trimester. I said that spontaneous abortion, there is no human interference. So 80% of them occur in the first trimester. Mostly and most often in spontaneous abortion, you find that there are no specific causes, but 50% of them are caused by abnormal fetal development or maternal infection, maternal chronic disease, or environmental toxins.
Lost her now. We have lost Jen.
Hello. Yeah, I think he has dropped off. I think he has serious network problems. It's disrupting us from watching this sweet presentation.
It's a very important topic, but the internet will not let her. Internet will not let her do it smoothly.
It's unfortunate. Jane, hello Jane, are you back?
Yes,
We lost
I'm
you. We lost you again. Okay, go ahead.
Okay, I've said before I got lost, I was saying that in induced abortion, it may either be legal or illegal. Illegally is where people will practice it there outside the health facility. Legally is when it is prescribed by the medical officers in the facility. And when we practice it legally in the hospital, mostly you'll find that it is carried out when the health of the mother is at risk. Mostly in our facility, we will find that we say that it would be better we lose the baby than losing the mother. Why? Because the mother is capable of getting pregnant. So we would rather save the mother and leave the baby, so that is when we will carry out a legal abortion if the mother's health is at risk. So there are complications of unsafe abortion, that is induced abortion that it has been carried out not practiced in the health facility or other medical supervision. So there are a lot of complications of unsafe abortion. There might be hemorrhages, which is the most common complication of abortion. Then we will have there will be infection, because if it is practiced in an unsafe manner, definitely there will be remains of the products of conception or trauma will be caused in the reproductive part. Also remembering and considering that this abortion has been carried out not in a sterile manner as it would have been carried out in a health facility setup. Another complication would be death. Death will occur as a result of, we have said that hemorrhage, which is the bleeding, may worsen and may lead to death. Also, infection may lead to death, where this person might get infected, will not know, and they are just at home. So the infection becomes chronic, then we will lose this girl or this mother or this woman of a reproductive age. Also, I've said there is trauma. If the abortion was carried out and there was insertion of foreign bodies, because most of the time we'll find that our little girls, our adolescent girls will be taken to places by their so boyfriends, to places they practice foreign objects are inserted, they get traumatized because they are doing it in an illegal manner. Another complication that may occur is that the procedure might fail. And if the procedure fails, then we might end up losing our mother, and she might end up having infections, and a lot of things might occur. How do we manage unsafe abortion? How do we approach an unsafe abortion? First of all, you have to do an initial evaluation. And when you carry out the initial evaluation, you have to monitor the vitals. I had said in my case study that the mother had a temperature of 39, a blood pressure of 95/45, and a respiratory rate of 22. Also, at what gestation has this abortion been carried out? Then is there vaginal bleeding? Is there is the vaginal bleeding partial, or there is total blood loss? What is the vaginal discharge? Then examination of the signs for infection. I have said that in my examination of the case study of my mother is that there was abdominal tenderness and abdominal guarding. Then carry out some investigation, like you carry out and perform an ultrasound and also lab investigation. So the general approach is that we should always consider the possibility of pregnancy in reproductive aged females. Patients or rather reproductive aged females who have undergone an abortion, they will not tell you. Sometimes they tend to hide it because they feel it is traumatizing to them, or they feel when they disclose it to you, how will be your approach? So also in the management, when now an unsafe abortion has been carried out, it has come to your facility, you have to carry out further management. Now that's a general approach. What are the further management that you are going to carry out? Because now it has happened and it is here with you. If the facility is well equipped, you may look for signs of surgical emergency. If there is a sign of surgical emergency, like heavy bleeding, abdominal pain, severe infection, and shock. Also, you can give intravenous fluids. In the intravenous fluid, also you can consider giving blood products which are necessary. Also, repairs of the active bleeding areas of the genital tract if there are lacerations. If there is intra-abdominal organ damage, you can also consider performing a laparotomy. You can also perform a manual vacuum aspiration. We call it MVA for retained products of conception. Also giving uterine massage and uterotonics like bisoprostol. And if your facility is not well equipped, kindly find it well to refer the patient, or rather the mother. So what are the clinical features of septic abortion? You may find that this mother or this female of reproductive age has got fever, abdominal pain, vaginal bleeding, and discharge. You might find their tachycardia, tachypnea, lower abdominal tenderness. The first treatment is evacuation of the products of conception in the uterus and administration of antibiotics. You start antibiotic therapy. Now, how do we prevent the unsafe abortions? Prevention of unsafe abortion requires multiple approach. First of all, we have to prevent unwanted pregnancy. That is where we have to start, because we'll find out that these abortions that are carried out legally, most of the times they are unwanted pregnancies from our let me call them females of the reproductive age. So first of all, we have to prevent unwanted pregnancy. And how do we prevent unwanted pregnancy? Through health education to our girls in school, in primary school and high school. Another thing is by offering family planning methods, because we will find there are girls out here who will come and they are very honest to you. And they will tell you that, for me, I cannot survive without having my male counterpart. for you don't fail to provide the family planning method so that we prevent this unwanted pregnancy that will come early, and then they will go and terminate the pregnancy in an unsafe manner. The other thing, how we can prevent, is through access. Improved access of safe abortion procedures. Most of the time you will find when you go to a health facility, because it is legal to perform an abortion, this pregnant mother will tell to go and perform it there because they cannot be able to access the safe abortion procedures. Cost also may lead for, may be a cause why they are not able to access the safe abortion procedures. The other thing is provision of high quality post-abortion care. Provision of high quality post-abortion care. I had said the other thing that I had said earlier in prevention, that you can also offer family planning or contraception counseling and services. Then there is, we reduce stigma associated with abortion, because I had said that you will find there is spontaneous abortion and there is induced abortion. In regards to spontaneous abortion, very many mothers, or rather adolescents of reproductive age, females of reproductive age, will face stigma because they had an abortion and now they see that the world is coming to an end. So if we the stigma coming along with abortion, we will fight.
This is a serious issue.
We will fight. We are preventing occurrence of
Frida, can you mute that? I think this is Mr. Otieno. Can you mute Otieno? Okay, go ahead, Jen.
Okay. Then what are the consequences of unsafe abortion? We have loss of fertility. There are psychosocial disorders. Disabilities may start from there. Maternal mortality, we might lose this mother. Then there is excessive cost to healthcare system, because when we find that there are too many unsafe abortions being carried out and the health system is overwhelmed with the medication these people will be using, then there is a lot of cost will be incurred in the health system. Now we get to the post-abortion counseling. In the post-abortion counseling, counseling after abortion is very, very necessary, because of what are we saying that post-abortion counseling is necessary? One is because this mother needs psychological support. This mother is traumatized, both physically, mentally, and to some extent socially. They cannot socialize with others. What if the abortion was spontaneous? The mother was not willing. Let's say it was out of a fall, trauma, because some will fall and then the pregnancy will get terminated. So these mothers, or rather these women of reproductive age, the after counseling is very important. So how should be how should that counseling be like? One, it should not be judgmental. So it should be non-judgmental. Don't judge this mother. Yeah, throwing words at them. You wanted it. Yeah, it happened because you wanted it to happen. No, probably she didn't. That was not her intention. So don't be judgmental without even listening to whatever they are going to tell you, because you might not know the reason behind why they intended to carry out the abortion. Secondly, the counseling should include STI and HIV counseling and testing. The counseling also should offer abuse and psychological support services. Also emphasize the need for future use of contraception. So in the time you are providing the counseling, try as much as possible not to be judgmental to your client. Try as much as possible to educate them of the after results, or I've said that afterwards you might find that this mother, there might be loss of fertility. Try as much as possible as a healthcare worker to tell them that if this happens, what is the next step that we are going to take? If there is loss of fertility, if there is disability that is going to come around, tell them the next step which they are going to take. Not for in the emphasis of the need for future contraception, that as much as we are going to offer all the family planning method, for septic abortion, we avoid intrauterine devices. You're going to emphasize on it and tell them if it's for spontaneous, the mother might want to get pregnant as soon as possible. So you get to educate them and tell them on what are they going to check out before they are ready to conceive the next pregnancy. Abortion, I've said once again, it may occur willingly or unwillingly. So as healthcare workers, let us try as much as possible to educate our females of the reproductive age and take care of them post-abortion, after abortion. Yes, and I think up to there, I can conclude my lesson. Thank you.
Thank you, Jane, for that. Hello. Okay, thank you, Jane, for that powerful presentation. Thank you for bringing this important conversation that people don't talk about. We have really learned the different types of abortions, how they occur, the risks associated with abortion, the management and prevention. Yes, we have really learned. So if you have questions, you can type them on the chat box. Meanwhile, I will welcome Dr. to give additional remarks. Doctor, you're welcome.
Oh, thank you so much, Glory. Thank you very much, Glory, first of all, for bringing us Jane Moravi. Thank you, Jane, for giving us a whole lot of information about a very delicate topic, abortion. Abortion is very, very delicate topic of conversation everywhere in the world. Say in the United States, there's always conflicts between the Republicans and Democrats about that issue. And also in the European Union, same thing. So it's the people cannot agree on what to do about abortion. And that, you see, when people cannot agree about what to do, first of all, there's religious conflicts, faith-based organizations, also of them having complete disagreements. Like the Catholic faith is different from the Presbyterian and Protestants. So that's a lot of fights and fist fights among people. And the conflict comes in when, people, let's say general population, people in the general public do not understand what is abortion. As Jane, what you have told us, there are two kinds. Some abortions are spontaneous, and when they're spontaneous, what should you do about it? So even many people in general public do not understand that. Some of them are medically indicated because the pregnancy is high risk already and poses the risk to the mother. Now that's the question: if the pregnancy has posed a risk to the mother, but the baby is okay, are you going to sacrifice the baby to keep the mother? See? So, and that comes to the question: when life begins, who is more alive than the other? The fetus or the mother? Who should die? See, these are become very big political questions. But see, I hope we do not have, then of course that question now, when the people are fighting about it over there, there is the woman of the reproductive age, particularly young women between the age of 15 and 25. So they are the most affected by these issues. And when the woman, another woman is herself, they are the center of the whole state, but always people are fighting all this political debate, all this political fight. Nobody asks the woman, what is your view? What should we do? What's your opinion about this matter? She's the one who gets pregnant anyway. So it becomes policy. Now that's when you're hearing about illegal abortions and legal ones. So what makes it legal or illegal? What makes it legal is that there's a doctor prescription who said this one, or say a medical professional said this high risk, so this abortion should go on. But then people do not know that. That means community education is much needed. And when people do not know, particularly young ladies who could get pregnant, and then they would not want to carry that pregnancy to term, even if the pregnancy is bothering them, and it's a high risk pregnancy for every reason, because high risk, what we must understand is how to define the high risk. Is high risk to what? Because risk can be social, can be spiritual, and physical. So I think today, when we talk about high risk, it's just focused on the physical body of the woman. But what about the other risks that we overlook? So because the other risks are overlooked, say the medical system, the medical establishment will only consider a high risk, the pregnancy is high risk if it has got physical consequences. As you said, for example, it has genetic problems, that's a physical issue, chromosomal defects, or it has something to do with the health of the woman or the mother, then that's considered high risk, the physical health. So other aspects of health, remember that from the WHO, the World Health Organization definition of health. Health is physical, mental, and even spiritual. Now, you can have high risk pregnancy if it's going to affect the mother mentally. It's going to have a negative mental effect. But that's not considered as high risk pregnancy in the traditional classification of high risk pregnancy. It can also be high risk because it's going to have a spiritual dislocation, as we're talking about stigma, whatever. So those things are not admitted in the classification of high risk pregnancy to make an abortion legal. The abortion is not legal if it is not going to have any physical outcomes. And of course, the medical outcome or the medical abortion then would be one that has got physical outcomes, and that makes it difficult. Now, if the pregnancy might have mental consequences, such as the pregnancy would lead to social isolation, and the lady is worried she's going to have has a lot of effect on her psyche, and she doesn't have any physical issues, then what they like to do, what she likely to do, she's going to go with her boyfriend to look for the backstreet induction of to induce the termination of pregnancy, to get a backstreet induction. Now that is an abortion induced outside a health facility by some people out there, and that is serious. There's a serious problem. I would say that is the commonest problem, particularly for young women, between young teenage women, because they are afraid of going to the medical facility because they don't even know whether it's. And you see, that's about community education. So I think we have major questions here. That what do we do about that? You have said that even counseling may not prevent the pregnancy for certain ladies. They will intimate to you that I cannot do without my boyfriend. See, something like that. And so this means that we need to understand where the person is coming from, what is causing them to end up in that. So I think, as Jane has told us, that the first line of defense is prevention, preventive education. That means massive community education, maybe through schools, and also the community education, in general, teaching people about why the different aspects of that lead to abortion, either the spontaneous abortion, which may come from physical illness, or the medically indicated abortions, which are now considered legal abortions, and even the other non-physical abortions like mental issues and spiritual issues that cause people to perform abortions outside the facility. Because whether we like it or not, we cannot remove mental issues and spiritual issues from the argument to say that we only need to say that we're only concerned about the physical aspect of the woman. The woman is also a spiritual person. The woman is also a mental person. That means she has a psyche that is not protected later on. So I think the worst thing is that, and I think I have several questions here. That now, what's the main observation in the market? Maybe Jen, you know about this. Are we seeing more abortions, say abortions in urban centers or in the rural areas? Jen.
So mostly they are carried out in the rural setup.
Yeah.
Yeah.
So in the rural areas, but they don't have rural areas. Are they doing them in the health facilities, or they come to the health facilities after the abortion?
Mostly you'll find that they will come to the health facility after they have carried out the abortion.
So, and what would you attribute that high incidence in the rural areas?
Pardon, please?
The rural areas, like the girls that living in the rural areas, why would they want to induce pregnancy at home rather than, or maybe they don't have access to health facilities in the rural areas. So it's only if it goes wrong, they eventually come to the health facility. Yes, so that's about access. So there's a lot of work we need to do. And you would imagine, you'd think that the girls in the urban centers are the ones who would have high risk pregnancy, but the rural areas is that girls in the rural areas may have, get pregnant, but they don't know where to go for for pregnancy counseling, first of all. So counseling is not sufficient in rural areas. That's one, preventive counseling. Number two is that health facilities are very far away from home. And so if it happens in rural areas, okay, Mr. MM, I think you are there. Can you mute Mr. MM? So health in the rural areas are, health facilities are far from, where people live, and people can perform an abortion in a dingy place. But then by the time they get to a health facility, so many complications have already happened. Like the case study you've given us, that person has got already infection, septic. It looks like she was going into septic shock. Her blood pressure has dropped. Her heart rate is very high, and she's breathing at very high rates, which are signs of shock. So she's going into shock. So that means that if something is not done quickly, that lady will die within another few days or a few hours. So it requires, you could say, that requires very urgent care. And that is what is a tragedy here. That how do we now manage? I think the biggest issue here is to prevent that from happening in the first place, the pregnancy from happening. And if somebody gets pregnant, to seek for proper place where they can, say high quality place where they can perform that abortion. But with all the politics in abortion, and without education about the mental health issues and the spiritual issues about abortion, about pregnancy itself, then people are tend to do what is not right, to do the wrong things, because they're afraid of exposure. Yeah, they're afraid of losing face in the community because say she got pregnant doing what? And so the stigma that's associated with unwanted pregnancy, let's call it unwanted pregnancy, because that's why they're trying to get rid of the baby, because they thought the pregnancy was unwanted. That is a mental issue. It's a psychological issue. The pregnancy is not unwanted, but somebody conceives that idea as unwanted. That has spiritual implications based on their their faith, either the parents or maybe the community, right? So in terms of their own faith persuasion, they think they're going to be frowned upon by the members of the community. That's why they would like to hide the idea that they were pregnant in the first place and go and try to get an abortion secretly, in hiding. But you see, bacteria and viruses, they don't hide. If you do it in an unsafe place and clean place, then bacteria and viruses are going to attack, and then they're going to expose that. So these are the matters we want to figure out. How can we now make sure that people can actually understand what they would consider unwanted? It's not really unwanted. That's the idea of unwanted pregnancy is you could say it's a human conception, and that can make them feel stigmatized about it, and then they go into hiding. So then because they're going to consider themselves unwanted, and that's why they're trying to get rid of unwanted pregnancy, because they consider it unwanted, they think that even the community wants to consider them unwanted. And that plays a huge role. It has a very huge impact in the psychology of the young lady. So counseling, very important. That the fact that she's considering the pregnancy unwanted, herself, she is not unwanted. So she can make a good decision knowing that she is still wanted in the community. And so she doesn't end up doing something wrong that will cause, of course, eventually unsafe abortion leads to so many medical costs, because if she was going into shock, you have to get her out of that shock, which is expensive for the health system, or even for the nation. People have to pay for that. And then she has to consume antibiotics to knock off those bacteria infections that come from unsafe abortion practices. And then she has to be hospitalized for a while. She needs clinical observation for a while. That's all very expensive. And of course, that may have serious consequences for her own physical health. So the idea, I think, it's in terms of counseling, and I think that's what we can do. And I believe that because we're in Actuate Nation, we're asking ourselves, how can we use Actuate token to incentivize counseling to prevent unwanted abortions, or to prevent, unwanted pregnancy that may lead to unwanted abortions, or even to promote safe abortion or termination of pregnancy for legitimate reasons. So that's the question. How do we use Actuate token to incentivize community education? Because you can see the biggest challenge here is access to safety. Access to safety. And that's safety means having facilities that are within reach, or maybe not just facilities, but having access to a counselor in the community, say in the village somewhere, somebody who can counsel the young ladies, whether through the schools or through high schools or local colleges, whatever they are doing, and somebody who is within the community who can do door-to-door services. That this girl, if she gets pregnancy, if she gets pregnant, then she can have someone to go to. Right now, she doesn't know who to go to ask for help or support, because there is no one for that. Then it's just a grapevine. She'll be asking, what do I do? Then she gets led into a back alley abortion. Yeah, and where they do now the unsafe abortion. Yeah, and I think we together, using with the Actuate token, we are actually well able to create a system that can reach people all the way down to the community, and to help increase that education, to remove the stigma about abortion. So if somebody conceives the pregnancy is unwanted, we need a lot of education, counseling for that person, so that the person can learn it's not unwanted really. It is, the unwanted is something conceived by the public, so the way the stigma that is now associated with that being pregnant because maybe she was not married, a lot of stuff, a lot of language that we can deal with, but that requires community education. And so let's see how we use Actuate token itself. And I'm happy to announce that we are thinking strongly about that, very seriously, about how we can use Actuate token to reach even the unreached, the people we are not able to reach yet, but we can reach them, to give them access, because it's about access to counseling and education services. And we shall be having a hackathon during the summit. And I think this hackathon is going to start now. Maybe Gloria is going to prepare the documentation for hackathon about this issue itself. Issue on health access. How do we use Actuate token to create access to all this access to education, particularly what you call health education through health promotion agents down in the communities. They get incentivized to teach people and to be there to provide the counseling services that that Jane has talked about. Thank you. Back to you, Glory.
Thank you, Daktari, for those comprehensive remarks. Yeah, today's topic it's a critical topic that we need to talk about every day. Yeah, as Daktari has said, and also from Moredi's presentation, is that people lack access to quality healthcare services. Even those are females that find themselves going for unsafe abortions. So here at Actuate, we are now bridging that gap using our Actuate token. Okay, I will send that document for hackathon tomorrow. Yeah, so that we can familiarize with it. Thank you so much to our topic master once again, Jane, for bringing this conversation. We also have we usually have these sessions every Thursday, such a time, discussing we discuss pertinent topics about healthcare access. Yeah, and on top of that, we have an upcoming summit at Kenyatta University that will take place from that to 6th of December this year. And Jane, we would like to welcome you. So this year's event topic is how we can use, because now there exists gaps in healthcare, in health access. So the theme of this year is how we can use artificial intelligence, blockchain, and decentralized finance, that is DeFi, to improve health and human development. And this summit will bring together various stakeholders from healthcare, technology, blockchain, and other businesses to facilitate idea sharing on how we can use these technologies to bridge that gap to improve health and human development. We have already secured some partners, and such as we have the University of Nairobi CD4 Lab, Kenyatta University IPTCC, and this will be the KO IPTCC will be bringing us Cisco, Huawei, and IBM. You all know of these reputable big companies, world companies. And we also have disease-centric workshop. I believe this is your area of interest. We have workshops for different diseases. Yeah, and yeah, we are the summit is gaining a lot of interest. It's popular. Very many people are willing to attend. Yeah, we would like to invite you and also your team, the team members you work with at your facility. Yeah. So, Daktari, maybe you have any other thing to add about the summit?
Okay, please confirm you can hear me, Glory?
Yes, we can hear you.
All right, yeah, thank you. So in terms of health access, well, we're gonna have a big workshop on health access. Health access is very big. And of course, also we have African women in decentralized finance. where I think we should address these issues on pregnancy, abortion, and the like. And I think this, particularly for health access, so we'd like to invite you, Jane, plus all your colleagues, to come to the summit and participate. It's going to be on December 3 to 6. And you see, the theme of that summit is we're asking how do we use decentralized finance on the blockchain, which means Actuate token, and artificial intelligence to improve health and human development. And this is going to be, it's a creative meeting. We have to create. It's a design meeting. Like, we have to design the future we truly want, as you have said, and that's why we need participation of multiple disciplines, professionals from maybe 5 types of discipline, from healthcare, medicine, say like yourself, and people from information technology. That's why we have IPTCC. That's the Institute for ICT Training at KU. And then and the University of Nairobi as the CD4 lab, which is computer science lab at University of Nairobi. So they come in, and they have also invited lots of people, companies, including cell phone companies like Huawei and other tech companies, as Glory has said. But besides those people, we have physicians, surgeons, and other health providers, let's say nurses and technologists coming, and other companies who make biomedical devices such as General Electric, and we're also pursuing Philips, and so many other manufacturers and pharmaceutical companies. So it becomes the big festival. The reason this summit has got so many different professions, because a design meeting, a design conference, or a design workshop. People will be working there to create the future we truly want. For example, now, question about this post-abortion care. We would like to create a future where post-abortion care, young girls can receive post-abortion care that is safe, high quality, and of affordable cost to them. Of course, coupled with all the counseling services that we can manage, and how do we distribute such counseling services with the Actuate token. So the big question for such a topic is how do we build a future that is perfect, that make post-abortion care very, very good, even for the remotest person possible in the community. So the summit is gaining serious momentum. It's actually startling to see that so much interest from people from so many different quarters in science, engineering, technology, and then medicine. And this is usually very, very hard to get people in medicine and people in engineering to be together in the same room. Even architects for the urban design, environment design, and they'll be there because we're going to have a huge workshops on environmental science itself. So people have are signing up. So I think Glory will give you more information so that you can spread to your network. The meeting, the event is going to be on December 3 to 6. And it's important that everybody registers. Right now, registration is wide open. It's on the website at actuate.bio. There's a lot of information on the Actuate website itself. Okay, so that's what I would like to add there about Glory. So back to you.
Thank you, Dr. So I hope everyone has understood where we are as far as our summit is concerned. Thank you so much once again for joining this session. Thank you for creating time. Thank you for being attentive throughout. And thank you to our topic master, Jane. So I will send you more details about the summit. And yeah, so I have shared the attendance form. We incentivize learning with Actuate tokens. So make sure you fill the attendance form. And thank you so much, Daktari, for creating time for this. And I would like to encourage everyone to keep spreading the good news and to bring more of your colleagues and your friends to this important conversation. It was so powerful. It was interesting. Don't allow to get this alone. Also tag along your colleagues. So once you fill the attendance form, unless there is any other concern, we are almost ending the meeting. Maybe if there is any other concern, we can end the meeting.
Okay. Thank you so much, everyone. Have a good one. See you again next week.